Hello, today's video will be about who should be diagnosed with high blood pressure. High blood pressure, it's a medical issue that affects 1 in 3 individuals in nowadays. In the other words, it is called hypertension. Before we start talking about what hypertension is, let's talk a little basic anatomy. The human body has a human heart. The human heart has 2 ventricles. The left ventricle is the strongest ventricle, and that part of the heart squeezes and pumps blood to the rest of the body. It does so through blood vessels, called arteries. Arteries take blood and allow it to travel away from the heart. The easiest way to remember that is away from the heart, it is called artery. When you measure blood pressure, all you're doing is you're measuring the pressure that's on the arterial walls. And there are really 3 major factors that play a role in this pressure. Number 1 is cardiac output, which is how much blood your heart pumps out with each beat. Number 2 is blood volume. And number 3 is that resistance your heart has to pump against. Normally when you visit a doctor's office or a hospital and you have a health professional measure your blood pressure, you see them use a cuff. That cuff has a name, it's called a sphygmomanometer. So we tend to use the term blood pressure cuff. The way that the blood pressure cuff works is by constricting the arteries within your arm. And while the doctor or other health professionals listening at the brachial artery, you hear that first sound of blood rushing through the artery, as systolic blood pressure, which is measured in millimeters of mercury. And then when that sound disappears, that's known as a diastolic pressure. Sometimes you see the numbers written as a fraction. The top number is the systolic number, and the bottom number is the diastolic number. The top number, also known as the systolic blood pressure, is the pressure during maximal contraction of your heart. And the diastolic or bottom number is when your heart is completely relaxed. Well, it sounds like taking a blood pressure is a fairly simple process. There's a lot that can go wrong. And there's a lot of room for error. The blood pressure cuff is too small. If the blood pressure cuff is used over clothing, if the patient hasn't rested for at least 5 minutes, if the arms, back or feet are unsupported, if the patient's in an emotional state, if the patient is talking, if the patient just had a cigarette, if the patient just drank a cup of coffee or had some alcohol, if the patient is cold, if the patient has a full bladder and really needs to use the bathroom, all those things can throw off the blood pressure and make it look like your patient has high blood pressure when they really don't. Because there are so many external factors that influence a person's blood pressure. We don't give the diagnosis of hypertension until we have 2 elevated readings from 2 separate visits. Let's do a little hypothetical here. You or even your family member is diagnosed with hypertension. What does that mean? What are you at risk for? Doctors make a really big deal about hypertension. So let's talk about it. Hypertension damages the blood vessels throughout your entire body, starting from your brain, to your eyes, to your lungs, to your heart, it's your kidneys, and even to your penis. But it's really important to say that having hypertension significantly raises your risk of having a heart attack, stroke, heart disease, and kidney disease. This is precisely why hypertension is known as the silent killer. Because you don't have symptoms until you're ready to have some serious complications. Having your blood pressure well controlled decreases the risk of dying by 25%. And it lowers your risk of having a heart attack and stroke by 30%. Now you want to treat your hypertension and you're not necessarily keen on going the pharmacologic approach right away. There are lifestyle changes you can make in order to lower your blood pressure naturally. In fact, 90% of hypertension is caused by poor diet, lack of exercise, and other bad habits. So if you're not exercising, you should be doing moderate intensity exercise for 30 minutes on most days of the week. Next comes diet, probably the most important thing that you can do to alter your blood pressure. The DASH diet, which is a specific diet, which I'll link down below, is one that's been proven to lower your blood pressure by 11 points. One of the highest successes we've seen for diet. The 2 bad habits that have been proven to elevate your blood pressure is heavy alcohol consumption and smoking. When we say heavy alcohol consumption, what we mean is more than 2 drinks per day per week for a man and more than 1 drink per day per week for a woman. When we speak about smoking, we're actually talking about smoking in any amount. So do not be a smoker and do not be a heavy drinker if you don't want your blood pressure elevated. Now these lifestyle modifications to lower your blood pressure work exceptionally well to prevent you from getting hypertension in the first place, so I always like to think in terms of prevention rather than cures. So follow these habits, live a healthy lifestyle, and don't develop high blood pressure. Normal blood pressure, pre-hypertension. Now a normal blood pressure is less than 120/80. And an elevated blood pressure is 120 to 129/80. And at that point, we should recommend healthy lifestyle changes and check it every 3 to 6 months. Stage 1 high blood pressure is now 130 to 139, over 80 to 89, which used to fall into the pre-hypertension range. And what it does is it spits out a risk or percentage of you having a heart attack or stroke within the next 10 years. If you have less than 10% risk, we have to stress the lifestyle changes and again reassess in 3 to 6 months. Now if your blood pressure is over 140 over 90, that's considered stage 2 high blood pressure at this point. We can start to consider a pharmacologic approach, in addition to lifestyle changes in order to get your blood pressure to the normal values. Now, under these new guidelines, approximately 30 million more people around the world will be defined as having hypertension. And while that sounds like a dream for pharmaceutical companies, it's not a party for them just yet. The reason being is that these 30 million people will be defined as having hypertension, but only about 4 million out of those 30 million people will actually need pharmaceuticals to keep their blood pressure under control. The best research done in the last 2 decades proves that controlling blood pressure to a tighter limit of 120 over 80 actually yields better results and allows people to live longer and avoid heart attacks and strokes. Number 2, there's a strong emphasis placed on measuring blood pressure in the correct manner. And number 3, they put a great deal of focus on lifestyle changes. This is something I preach everywhere I go. And with every patient I meet, it's much better to prevent this problem than to take a pill once it's already there. We know we don't treat hypertension. Well, there's a couple of reasons for that. Number 1, patients don't often come in for screenings unless there's already a problem. And we don't catch hypertension when we should. And number 2 is when we actually do catch hypertension, and we've tried lifestyle factors and they haven't worked. We prescribe a medication and oftentimes patients are reluctant to take their medication. Here's the thing, if a doctor recommends a medication, I'm not saying you have to take it. What I'm saying is if you tell your doctor, you're going to take it because if you don't, you're ultimately putting yourself at risk. Some people decide to not take a medication because of its side effects. There are alternatives. You're not supposed to take any one medication or these 2 medications. There are definitely options. And you should always talk about your worries with your doctor because the last thing that we want as doctors is for you to have a problem and not have it treated simply because of a miscommunication. High blood pressure is a complex topic and it has major implications for your health. I hope this video was able to demystify a little bit of what the illness is, and steps that you can do to not only prevent it, but to treat it in case you already have it. I know I didn't cover everything there is to know about hypertension within this video. So if you have some remaining unanswered questions, leave them down below in the comments so I can respond. Thank you for watching.